stretching ideas to get your knee straight. A lot of people struggle with getting your knee straight. It is one of the most common things. People ask me, what stretches can I do to straighten out my knee? I still have a little bend in my knee. So this is my favorite one. I call it the 2-chair straight knee stretch. That's just what I call it, so it's easy to remember. So you just need 2 chairs. The first one, the first level 1 of this stretch is just propping your leg up like this. So this, if you are like a couple weeks out of surgery, this is really challenging. Most people, their knee will look like this, if you can see my knee bent. And you'll have a little bend in your knee. That gravity pushing down to straighten out your knee, that is really intense after surgery. So most people, I'll time them and I'll say, okay, I'm gonna time you. Let's see how long you can hold this stretch. Usually the first like week or 2, it's only about 30 seconds and then they're like, oh, I gotta put my knee down. That is really intense. And you'll feel the stretching in the back of the knee. So this is a really good one for the first like 1 to 2 weeks. And then eventually you can make it more difficult. And with that, you can take any sort of towel or anything. This is a random pillowcase I just had laying around, and you'll do a roll up like this, and then you'll put your foot on the rolled towel, and that will cause even more pressure to get it straight. And the back of the knee will really pull when you do this one. So this is like level 2. Once you mastered level 1 and you can tolerate this pretty well, you can go to level 2. Maybe level 2 you'll be at, 4 to 6 weeks post-surgery. The goal is the longer you hold it, the better. If you hold this for 15 seconds, you're not quite ready for it yet, I would go back to this one. And my goal with my patients is, okay, let's hold this for like 5 minutes if you can get there. Some people can't get to 5 minutes until they're at week 6 or something though. So as long as you can hold this is better. Okay, and then if you're really struggling with your knee extension, this is the third level to make it more challenging. So you take a plastic bag, and I always open the holes where the handles are a little bit wider because you're gonna stick your foot through the hole, just like this, okay? And then the handles are gonna go right around the knee joint. And then you're gonna put 2 cans in the bag. And it's gonna be like a weight. 2 cans is usually enough for the first time you do it. You'll have it like this, and you'll sit here and you'll be like, that's not too bad, I can handle this. And then after about a minute, you're like, whoa, those 2 cans really make a difference. So this is a good idea if you are struggling. I usually do this one 6 weeks and on. So I won't start this one until you're about 6 weeks post-surgery because it's pretty intense. So this is another option if you need it. And sometimes the weight of the bag can be irritating, so you can get like a towel and put it underneath so it's not hurting your skin, because sometimes your skin can be really sensitive after surgery, so you can do something like this so it doesn't irritate your skin. Okay, another tip to see if you still need to be working on your knee straight, your knee straightness, is putting up your surgical leg. So this is my surgical leg. I still maybe have a little bend in it, just a tiny bend. And then you put up your other leg, your non-surgical leg, and you see the difference. Okay, this is my surgical leg. I'm gonna put it up. I have a little bend in my knee, right? So you put up your non-surgical leg to see how far you need to go to get your leg straight. Okay, my non-surgical leg, you see it disappeared? This one's super straight. So that means I still need to work on this leg. I still need to get it straighter. So I still need to do my stretches with this leg. Once these legs even out, and you can see they're equal, then you've done your work and you're good to go. So if your leg looks like this compared to the other leg, then you are not quite ready to stop your stretches yet. It needs to be even. So that's a good way to see how you're doing and monitor your progress.